Man, I'm just looking for some information on this new dental school, High Point University, down there in North Carolina. Let me see what I can find online. Man, they got a good amount of stuff here, but I'm looking for student Dr. Eli. I know he had those videos before giving us all that information, but I need more.
Good morning. My name is Nainee. I am a D1 student at High Point University Workman School of Dental Medicine. I am from Dallas, Texas. So let's get right into it. I will give you guys a little overview of my educational background. To start off, I am a non-traditional student, and I was also pre-med before I switched to pre-dental. So we can dig a little bit into that. So I did my undergrad at Texas A&M at Corpus Christi, graduated in 2016. And after I graduated, I did take a couple years off and just worked. At the time, I mainly worked as a medical assistant, working with cardiovascular offices mostly. And I did that for a couple years, and it eventually got to a point where I wanted to do more. So I started looking into master's programs, and I came across, I got into the G² program with George Mason and Georgetown University. Fun fact, that's actually where I met Eli. That master's program was also I would say the most exposure I've had to the world of dentistry. Our class was basically split down the middle. Half of us were pre-dental and half of us were pre-medicine. So I made a lot of friends who were on the dental side of things, and it kind of just made me question if I was interested in that, and that kind of pretty much where it all started. But after I graduated from Georgetown, summer of 2020, with my master's, I actually took the MCAT, and I did well enough to where I was confident enough to apply to medical school. I actually, submitted all my primary applications. I even got back my secondaries. And it was at that time where I think I was questioning if this is really what I wanted to do even more. Which was kind of tough, because I'm like, I really could have gotten into medical school, but I actually took all my applications out of the application bank, essentially withdrawing them. And some of my dental school friends just told me, look, Nainee, you need to just go shadow a dentist, so you're not questioning it down the road. And that's exactly what I did. I withdrew all my applications from medical school, and I started shadowing my dentist. And shout out to Dr. Chitri, she was amazing. So once I started shadowing her, we had a lot of conversations about my passion, what I'm good at, what I want to do, where I see myself down the line. And dentistry is just what made more sense to me. And I just started exploring more. I shadowed her a lot more. And yeah, that's basically where it started. And another thing that made me feel like I was where I needed to be was, as soon as I switched to pre-dental, everything just kind of started falling into place. I didn't feel like it was a struggle anymore. I just felt like that was where I was meant to be. So fast forward to applying to dental school. I've always been interested in HPU, just because when I was doing my master's with Georgetown, that's actually where I found out about the HPU program. I think at the time they were still developing the school and the curriculum and all of that. And so I always kind of had it in the back of my mind. So when it came time to apply, I applied to that school. And I know HPU is a school that everybody is curious about. Everybody has questions. And hopefully today I can do a good job of answering a lot of the questions that people have. But one of the main reasons why I ended up picking HPU at the end of my interview cycle, application cycle, was just the experience that I had when I went to my HPU interview. There was a moment where, before we started the interview day, Professor Worth, amazing, shout out to her, she actually made us sit down and meditate. So immediately I felt like the program had a big emphasis on mental health, which is so prevalent, which is so important. I think more schools need to focus on that. That was just one thing that immediately I was like, wow, I love this. And I think that entire day interviewing with them was just a really good experience overall. You could tell that the faculty wanted to be there. You could tell that they were passionate about this school. They wanted the school to succeed. And it was just a no-brainer. I know it's cliche to say, but when you go to your interviews and when you see the school, sometimes you just know. You just know. So when I got accepted, that's where I wanted to be. So here I am, and I am about a month into my D1 semester, and so far I'm loving every second of it. I think I made the right decision is what I'm trying to say. And it's also cool that we are literally the first cohort of this program, meaning that there are pros and cons, yes. We essentially are the guinea pigs. So we get to experience a lot of the firsts, but that can also be a cool thing because we get to structure a lot of the things. So for example, once we take our exams next week, I think, and finish the module that we're currently in right now, we actually we get the opportunity to start planning all the clubs and activities for our school, which is kind of cool. We kind of get the creativity to work on stuff like that. And that's just, clubs and associations. There's gonna be so many other things that our class is gonna be responsible for building, and building that culture for our school for the upcoming classes. So I'm here for it. And there were also just other really unique things about the school that also really attracted me to it. For example, like I said, I'm on week 5 right now, and next week we have our white coat ceremony, and after that, as soon as week 7, we get to start seeing patients. We get to be in a clinical setting, and just getting that experience was really important to me because I'm a very hands-on person. I would much rather be hands-on working on patients in a clinical setting than be in a classroom getting lectures all day long. So that's a really neat thing that attracted me to HPU. I mean, yes, we're getting the lectures right now, but we're also getting the hands-on experience. I'm getting that patient-to-patient experience. So yeah, I am really, really excited. So today, hopefully I can show y'all a little bit of what we're doing here at HPU. And yeah, I'm gonna go get ready for the day, and I'll check back in with y'all. All right, we're all dressed and ready to go. The scrubs for today in all black, nothing fancy. These pants are super old. This scrub top is from our school. It has my name and our logo on here. We got a long day ahead, so let's get on the road before I run late. I swear, I feel like no matter how early I wake up, I'm always rushing to get to school. But anyways, today is one of our longer days. I'm in class I'm on campus from 9 to 5. First thing that we're doing today is lecture. We are going to do a lecture. We've been doing a lot of common systems. We've done diabetes so far, hypertension, and today is hyperlipidemia. And after lecture, so lecture is from 9 to 12, and 12 o'clock is when we have our lunch break. Once we come back from our lunch break, we are going to break into groups, because it is 60 of us, so I believe we're going to be breaking down into 3 separate groups. And we're going to be doing sim lab, patient history, like actually physically doing it, and head and neck exams. So our program is a little different from others, as we all know. We're doing a lot of things very differently than what you would see in other dental schools. We actually get to start going to practices, private practices that our school is networked with, as soon as our 7th week into the semester. So currently I'm in week 5. Next week is our white coat ceremony. And yeah, so things are moving pretty fast. But because we are in the clinical setting so early into our dental school career, a lot of the stuff that we get taught, or a lot of the stuff that we're getting taught right now, has to do with patient care. Because we're going to be in a clinical setting so early on into our dental school career, we're getting taught a lot of patient care stuff. So, for example, the head and neck exams, how to take patient history, just like the culture of being in a healthcare setting. Our semesters and schedules are also set up in a very unique fashion. We're not necessarily taking like a certain number of hours. Our schedules are broken up into 6-week modules. So currently we're in module 1, but we're about to finish our very first module. So this week is like our last week of the content that we need for basically like a midterm, final, whatever you want to call it, that we're taking next week. So Monday we take a performance exam. So they're going to be grading us on doing proper head and neck exams, patient history, like actually being able to perform them. And then on Tuesday is like our multiple choice written portion of the exam. And once we finish module 1, we move on to module 2. And module 2 is going to be a little bit more exciting because we get to be in sim lab a lot more. So definitely looking forward to that. Right now for this module, we've literally had an exam every single Monday leading up to the big comprehensive exam on week 6. In my opinion, I kind of like it. I kind of like the exams every Monday. Well, I hate the part that we don't really get to enjoy our weekend because we're just studying the whole time. But I like the fact that it's forcing you to study the material and you're getting tested on it little by little. So there's no room or no excuse for procrastination. So by the time you get to the 6th week, your 6th week, where you take the big exam, the big comprehensive exam, you should already know the material, essentially. So it is a pretty cool system. However, this next module, module 2, we're not going to have exams every Monday. I believe it's going to be every 2 weeks. So that should be a cool little change. Yeah, I think that's pretty much it for now. I will check back with y'all once I get on campus, and we'll go from there. Oh, no, it's recording. Say hi, E. It is now. Yes, that's yours. So, this is from my friend Eli that goes to Boston University, and he wants to know, or your viewers want to know about HPU. Okay. So, y'all are gonna get a day in the life of an HPU, Workman School of Dental Medicine. It's now 12:45. It's our lunch break. We go back at 1:30. I'm new to Publix. I don't have Publix grocery store in Texas. And hold on, these subs, fire. I am obsessed. So that's what I'm having for lunch. I will see y'all when we get back into class and we do sim lab today. Scared.
It feels so good.
We need a bid for him.
Seriously. And it's
I know.
I tried to tell when you showed me the flushing. So,
I wasn't here for that.
okay.
Oh, there you go. You're welcome. Thanks for showing me that. Thank you. I know, it's hot. I know. Yep.
Definitely my presentation has been much better. I think my teaching is relatively from the middle of the first and second line.
This is our first time drilling. How did you feel?
Scared.
Yeah, me
I was going to hurt my fake mannequin.
Yes. We kind of didn't get a lot of directions, so day one not too bad. Drilling
We
into
only
a
did
tooth.
2 seats.
Two in an hour?
I don't know.
I think it took us an hour to do 2.
I'm sweaty.
Me too. Let me see how the guys are doing. How did y'all do?
We getting right over here.
Yeah?
Alright, man.
Let me see y'all's teeth.
The
Let
composite.
me see.
The composite.
The composite.
Composite. Call them out.
A plus. So this is a rubric for a head and neck exam that we have coming up on Monday. I'm gonna be recording them doing it for us.
Oh, welcome to the vlog, guys.
Welcome to the vlog.
I'm grading you.
Oh, you are?
Yeah.
Okay.
She's the grader.
Awesome.
Patient, doctor.
Okay, I'm gonna run through it like it's legit. So I'm gonna step out. Hey, give me my sheet, boy.
No pressure.
No, not at all. This is where stars are born. Hey,
How you doing?
how's it going?
Pretty good.
My name is Mark Sidek. I am a DMD candidate at the Workman School of Dental Medicine. How are you today?
Nice to meet you. I'm doing well.
Good. We'll just be going through an extra-oral and intra-oral exam. It should be a smooth process. Everything should be okay. And if at any step there's any complications or you feel any type of pain, please let me know. We can stop and evaluate it. But to get started, can I get your name and date of birth just to confirm things?
Yeah, for sure. My name is John Doe. I was born November 1st, 1901.
Okay, awesome. Well, nice to meet you, John. And of course, it's totally up to you, but I have permission to observe you. I'll be touching you around your head and neck, and I'll be going inside of you.
That's fine. Just don't get too frisky.
Nope, I won't get frisky at all. But okay. Any issues so far? Any type of pain of some sort?
Nothing serious. Like my jaw's a little sore sometimes when I wake up. But that's
Yeah.
about it.
Oh, okay. Is it more like just soreness or cracking, or what is it really?
Really just soreness as soon as I get out of bed. Kind of like the first couple hours of the morning,
Okay.
and then it kind of subsides as the day goes on.
Got you. Okay, yeah, well, we'll just be starting off by looking at you, looking for symmetry, but you're such a handsome man, everything looks really good, looks perfect. I don't see any issues there or there. If you can, can you squint your eyes for me? Can you raise out your eyebrows? Can you smile? Can you frown? Can you stick out your tongue? Any discomfort?
No.
If you move your jaw out and left to right? Good?
Yeah, all good.
All good? Okay, awesome. I'll be coming around here, checking for your... Oh, it's right here. If there's any discomfort, yeah. Mental, no. Any pain here? Nothing at all. Okay, good. May you look to one of your shoulders and look down at it. Okay. Upper cervical. Lower cervical. Any pain here?
Nope.
Okay. May you go to the other shoulder?
Nope.
Any pain here?
Nope.
Okay, good. I don't feel anything, but usually for this test that means something good. May you raise your shoulders, please? Awesome. No pain?
Nope.
What about right now? Nothing at all?
No, not that I can feel.
Is there a little scar over here?
Yeah, I've had a lymph node that's been swollen on that side for a few years, but
Oh,
you know,
okay.
I've been told it's not really an issue.
Is
So.
it just sickness or something started it? Or?
Yeah, it was like an old infection, just kind of like a scarred leftover.
Got you. Next, I'll be checking your TMJ for any type of cracking or any discomfort at all.
Okay.
If you can open your jaw for me. Ooh, can you close it? Can you open it one more time? Can you close it? Sorry, my sister over there is laughing. Okay, one more time for me. You can close it. Okay, good. I don't see any issues. I thought I heard something, but is there a little crack or does it?
I mean, it happens occasionally.
It happens
but
occasionally.
No pain or anything.
Yeah. Okay, that makes sense. Other than that, your lip color looks good. I don't see any lesions and I don't see any issues of that sort. But if you're okay, do you have any questions for me? Okay, well good. You look good. Everything looks good. I don't feel anything abnormal, any lumps. So this
Good
is
to know.
news. Yeah, for sure. Next we'll be going to the intraoral exam. Of course, if you don't mind, I'll lean you back a little. This chair is from Timu, so it doesn't really work. Just gotta
Make it happen.
Yeah. Thank you so much.
Yeah.
Thank you. And
Not Timu. It's y'all shading our chairs.
no, our other chairs are really good, but
But
It's just this one.
it's just this chair. Yeah. I gave the nice chairs to the other ladies because
I understand.
Yeah. 'Cause what if,
Ladies first, right?
what if I'm practicing in a third world country? You know,
Right.
I can't
You
come
wouldn't
Right.
have, you wouldn't have equipment like this.
Right,
so you
right.
did, you know.
But again, if I just want to ask again, is it okay if I touch you and go open inside your mouth? If there's any discomfort, of course you can let me know.
Usually I'd say no to that, but you're a doctor, so you know I gotta
Thank
say
you.
yes.
Thank you. Yeah. A lot of years for this, years to show. Okay, great. If my assistant, maybe I should come into the picture. Hold my light. Yeah. Thanks so much. This is my
Four-handed dentistry, right?
Yeah.
Four-handed?
Yeah.
Four-handed.
Here, here's my light right here. Awesome. And give me one more moment. Yeah, I just want to make sure, safety first.
That's a cool mask, man.
Yeah,
You can,
yeah.
see the lips and everything.
Right. Also Timu. Yeah.
No, that's good for people that read lips, though, you know.
Yeah. I actually have a mirror in my backpack, so I don't know why I'm using this.
Whatever gets the job done.
Yeah, whatever gets the job done. Alright, well, first we'll be palpitating the lips. Everything looks solid so far. I'll be opening in here. Looking inside, feeling up in the lips. Everything looks solid. Looks like you take great care of your teeth. Yeah, the color looks good. I don't see any swelling so far. I will be inspecting. Gonna take some of this right here. I'll be inspecting with my mirror. If you can open again, the inside of. Oh, I see some linear. Your hard palate. Let me feel your hard palate and soft palate.
That tickles.
Oh, sorry. It does get a little bit ticklish. I see. Do you bite your sides sometimes, or grind at night? Okay, cool. Everything looks good. Did you,
I grind at night.
Yeah. Awesome. If you don't mind, of course, if you can stick out your tongue, I would just like to inspect
You want
it.
to say ah and everything?
You don't have to say all right now.
Okay.
I'll just be feeling inside of it, and I'll be grabbing it. Feeling this side. Oh. Awesome. Any discomfort there at all? Nope. Okay, great.
Besides someone grabbing my tongue, but you
No, I know it gets a bit weird, but we try to go through it fast and do it properly.
No,
I don't see
sure.
any
Gotta be
discomfort.
thorough.
I don't see any discomfort there at all.
No.
If you can raise your tongue to your roof, yeah, I'll be feeling your soft palate under here. Oh. Okay. Nothing good. Maybe a little bit of tori, but everything seems good.
What is a tori?
Tori is extra bone growth. It's actually pretty common. There's most people have it actually. A lot of people have it and don't realize it, from what I understand. But yeah, it doesn't really affect in much way at all. And also, I will be grabbing this. I won't go too deep, since you told me you get a little ticklish. But can you stick out your tongue and say "ah" for me? Ooh, one more time. Awesome. Any discomfort with your tonsils or area like that? No, not at all. Okay, awesome.
Something look wrong?
No, nothing looks wrong. Maybe your right tonsil looks a little swollen, but that can be anything these days, really. Your mucosa and everything from the inside again looks good. If you can open up one more time for me. Everything really does look solid. Yeah, well, thank you so much. Again, you can close your mouth. I'll be taking these off Do you have
Don't want
any?
to catch any flies.
Oh, this is my head doctor.
Oh, wow.
She's really the best. Do you have any questions for me at all?
When I be flossing sometimes.
Yeah.
I be bleeding sometimes.
Yeah.
Is that normal?
It is normal if you haven't flossed for a while.
Oh, okay.
Yeah,
I only floss like once every like 8 months.
Right,
Every time I come to the dentist.
No, that makes sense. It sounds funny,
I flossed this morning.
most people, most people floss for the first time the day before their dentist, so
Yeah, no.
I totally understand. But yeah, it's common if you haven't flossed. Your gingiva just gets irritated, and
A little
that's
bit of
why.
sensitivity.
Yeah. But to wrap things up, everything looked great. It looks like you take great care of your teeth.
Appreciate you,
No,
Doc.
of course, and of
Yeah.
course we'll get you to the next step. So thank you so much.
Yeah, no problem.
Thanks for coming.
Yeah.
Thank you.
Oh.
It is 4 o'clock.
That's your phone.
We actually got done an hour early. We were supposed to be out at 5, but
That's because
since we have
doing it.
an exam on Monday and Tuesday, we're all staying here and studying.
Yes.
So I will record that so y'all can see the group study session.
I want to go back to Iceland.
Oh my god, so fun.
It was fun.
During our break, we can go play with the haptics. If we can buy it.
Yeah, let's do the haptics.
Okay, it is now 7 p.m. Finally leaving school. I had a good study session, but I am actually brain dead. I feel like I'm not really retaining anything right now. So it's time to go home, freshen up, and get back to studying. So normally I would go to the gym after classes are over, but I still haven't found a home gym here. I was doing a trial at one of the gyms, but my trial just ended, so I'm back on the market trying to look for a new gym. So no gym for me today. I probably won't even worry about finding a new gym until all my exam, midterm stuff is over. So honestly, you guys, I'm probably just gonna go home right now, shower, probably take a nap, and wake up from my nap and continue studying for the rest of the night, and then I'll probably just go to sleep early. So yeah, I'm gonna end the vlog here because I feel like there's not much else I can show y'all. Honestly, y'all, like I feel brain dead. It's been a long day. I've been up since 7 p.m. and I mean, yeah, it's time for me to go home. I've been up since 6:36-ish a.m. and it is now 7 p.m. and I still have a long night of studying left to do. So yeah, thank you for watching. I know people have been so curious about HPU, so I hope that this gave you guys a little insight and maybe even answered some questions. But if y'all have any other questions that you want to know about this program, about this school, just anything, y'all can message me on Instagram. Hopefully my Instagram title will be popped up somewhere here on the screen, but it's at Nainee Narden, which is just my full name. But yeah, thank y'all for watching, and for all the people that are getting ready to apply or are applying in the current cycle right now, I think interviews are going on. Good luck. Don't overthink it. Whatever's meant to be will be. It's cliche, but I promise. I promise. Love y'all. Bye.
I'm not even gonna lie, y'all. That was a really good vlog. Can we clap it up for Nainee? If you want to leave your support for Nainee, please clap it up in the comments for Nainee. She actually said she might start posting more on Instagram or TikTok. So if y'all want to see more of High Point University, y'all know who to go follow. Anyway, I just want to thank Nainee for doing this for the channel. When I found out that she got into High Point University, I immediately congratulated her, and she thanked me for like all the advice and the videos that I make and stuff, and you know, as her way of paying me back. No, I'm joking. But as her, you know, way of paying it forward, she was elated to do this vlog for the channel, and I'm glad she did it. She really, really did a good job. Funny story. She didn't mention this in the vlog. I didn't know if she would. But like Nainee said, I met her when we both did the same post-bacc program, George Squared. And I actually met Nainee on the first day, like during orientation day. I was with her and like a couple other friends that I still keep in touch with today. She actually mentioned that day that like she had a small interest in dentistry, but she was sticking to med school. And I was like, you sure? You sure? And look how things turn out years later. Anyway, stay tuned. I also have a day in the life at Kansas City University coming soon. Now, y'all know Kansas City University is another new dental school. I think their first class started last year, so 1 year before Nainee's class. And I have someone doing a vlog there because, like I said, I want to get y'all the information. And I know y'all want to see what these new dental schools are like. So, come on. Clap it up for Nainee. Clap it up for student Dr. Eli, because this is the best dental school channel on YouTube. Stay tuned for the next. I'm out.